I got a voicemail, somebody had an emergency, I can call them back, schedule them and see them. And people really valued that speed at which I was replying. A lot of people would call and say, oh, I've called 5 offices, nobody answers, left messages, nobody answers, thanks for calling back. And I would go in and see those people. So it allowed me to respond really quickly.
No, but you brought up a good point, right? Being on cloud, being forward thinking and future thinking, how did that prepare you for COVID-19 being like disaster ready for, like you were already on the cloud, you had just bought a new practice, you were running 2 practices, one mobile and one brick and mortar. Can you maybe explain to us what your reaction to COVID-19 was and how you implemented?
Yeah, I mean, it was, well, I don't think anyone was ready for it. It was surprising. The benefit to with tab32, I could have both practices. I could just toggle back and forth between them. So I was able to kind of check on everything, check messages from people, voicemails, all of that. Because people were calling and texting and all of this and, not knowing what to do. And then y'all had the little, the COVID notification, which was so helpful. Because then I didn't have to, do it all myself. But yeah, I mean, I think it gave me a lot of freedom to where I could just, I couldn't go into the office. So here I am, I can manage everything from behind the scenes. I could still work on stuff. I could still, plan stuff in the future and block out dates and message people and, follow up with anything. I just that accessibility from anywhere to me is not something that exists in healthcare, again, because we're all very antiquated. All of our technology is so far behind that I really feel like tab32 is moving forward into the future. I think that, to me, cloud-based is where everybody will be in 10 years.
No, definitely. I agree. And everything's trending that way as well. So once again, for those of you who don't know, tab32 is a complete solution. We aren't just the practice management. We are a complete communications platform as well as billing. And so as soon as COVID-19 hit, we immediately created a button for our providers at the top so that they can mass text and mass email their patients, keep in touch with them. And because of that tool, a lot of our practices reported retaining patients. Versus where, if they would have just went dead or because they couldn't go into the office when the office closed, they really credited their tab32 for being able to retain those patients through COVID and grow because they were able to say, hey, we are seeing patients now. Did you know that? You can come in even beyond emergency work depending on what state you were in. So it really allowed that care communication to happen with the patient.
Yeah, and calling, we have people calling and leaving messages and you could check them, right away rather than oh, my front desk is going in tomorrow at 8 a.m. from 8 to 9 to check the messages. I got a voicemail, somebody had an emergency, I can call them back, schedule them and see them. And people really valued that speed at which I was replying. A lot of people would call and say, oh, I've called 5 offices, nobody answers, left messages, nobody answers, thanks for calling back. And I would go in and see those people. So it allowed me to respond really quickly. And people could still book online. They could put an emergency thing in if they needed something. So I got those requests and it was all very immediate, which I think was what people were looking for. They wanted somebody they were sitting at home doing nothing. So they expected you to call them.